closing the blinds and blocking out any light while you're sleeping could help protect your health. Dr. Reena Mehta joins us now to explain why this is so important. Hi, Reena. Good morning.
Hi, good morning. Thank you so much for having me.
All right, so why is it that even a little bit of light in your room at night could be detrimental to your health? How so?
So this was a study that was recently published where they looked at adults who slept at night, and they basically looked at if they had moderate light when they were sleeping or if they were in a dim light or no light when they were sleeping. And what they found was that those adults who were exposed to moderate light, so that could be lights from your TV, that could be street lights, that could be your overhead light that you have on or your night lamp, they found that those adults actually had the next morning increased insulin resistance and higher blood glucose, leading to an increased risk of diabetes.
That is so interesting. I mean, what is it about the light, though, do you think, that causes that?
So that's a great question. So normally your nervous system has a sympathetic nervous response and a parasympathetic nervous response. Your sympathetic nervous response is supposed to work during the day, and that's when your heart rate is increased, and it gives you energy to take on all of the tasks that you do, and that's usually stimulated by light. So in contrast, at night, your parasympathetic nervous response is supposed to kick in, where it decreases your heart rate and cause more of a calming response. And so when you have the light on at night, it's actually confusing your body, and it's, changing your nervous system so that your sympathetic nervous response is activated when it's not supposed to be, and it increases your heart rate. And so if your cardiovascular system is off and not where it's supposed to be, then that stimulates your body to increase insulin resistance and increase your glucose, which can then have a long-lasting impact even for years to come.
That's interesting. So what if you're somebody that, you need to have a light on? Maybe if you're older, you need a light on if you have to get up in the middle of the night, or like kids, for example, my kids have a little night light in their room. What is the best way to kind of go about doing that without messing up their sleep?
Yeah, exactly. That's a great question. After I looked at the study, I even thought to myself, I often fall asleep with TV on. My kids have their night light on. Are we actually causing more harm by doing this? But at the same time, you have to be safe. And so some simple tips could be, number one, if you can turn off your lights, great. If it's a safety concern, then use a small dim light that's close to the floor. Because if it's in your face, then it's stimulating your eyes to sort of wake up, and then it increases your heart rate. So keeping it close to the ground is helpful. The other thing is the color of the light makes a difference. So those blue and white lights are actually more stimulating for the brain. So if you can transition to using something that's more like a red, orange, or amber color light, that's actually better and more calming for your nervous system. And then the other thing is, if you can't control the light, then another thing that can be helpful is those blackout shades, or even like those eye masks that you can wear that can help block out the light.
Yeah, I guess if you have like a street light or something outside of your window, you can't necessarily prevent that from being off, but if you put up shades or an eye mask, that could potentially help.
Exactly. Sometimes you can't always control it, but it is interesting. I mean, if you can make some simple changes in your day-to-day routine that, it's not really that hard to do, maybe it can be more healthy for you in the future just by blocking out some light.
And I mean, this study isn't saying that everybody that has light on, while they're sleeping is going to develop diabetes. It's just, it could potentially happen.
Yeah, so there's been a few studies that have looked at people who are exposed to, and this is moderate amounts of light, so that's a bright light. People who are exposed to moderate amounts of light actually are more obese or overweight and have more risk factors for diabetes. So this study is taking one step further to say, well, is there a mechanism to explain why that might happen? But this isn't saying everybody who sleeps with light is going to have diabetes. No, absolutely not. It's just saying this is another one of those potential risk factors that maybe if you can control it, maybe it'll help. Maybe it won't, but it's still something to think about in your day-to-day routine to hopefully improve your quality of life later.
Absolutely. All right, Dr. Reena Mehta, thank you again for your time. We appreciate it.